Yes.
Kat was ready long time ago. But you can confirm, Kat?
Yes, all good.
Okay. Okay, colleagues, let me start. Good afternoon, everyone. Thank you for joining us on today's webinar. And also let me first apologize to our participants, both that are online here with us and those that are on YouTube. This is Dr. Ngobo Winnie, who will be facilitating this webinar of today. Without wasting any more time, because we are already late, let me just introduce to you, we all know, good people, October, it's a mental health month. And yesterday, if I'm not, was it yesterday? I think yesterday, it was Alzheimer's Disease Day. So we are very much relevant on what we are doing, because mental health is the main key thing that affects each and everyone across the board. And there is no one who is exempted on actually suffering from mental health or developing mental health problem or condition, regardless of race, color, or creed. Now, let me quickly introduce our speaker of today, who will be actually talking. She will be talking on us about how to deal with anxiety in the midst of COVID-19. We know that we have been affected by COVID-19 since 2020 March. Now, we just want to know, now it's post-COVID-19, then now dealing with anxiety in the midst of COVID-19, and that will be done, it's going to be done by, or presented to us by none other than our senior clinical psychologist from the Department of Behavioral Medicine, who is Ms. Siotula, who is a senior clinical psychologist and a lecturer who is based at Fort Napier Hospital. She provides community clinical psychology services at Fort Napier Hospital that are aimed at increasing the accessibility of clinical psychology services in the community health facilities, such as clinics and district hospitals around Pietermaritzburg. Her main roles include supervising intern clinical psychologists, those who are intern, who works under supervision, and also those who are at master's levels, and also lecturing on mental health issues to undergraduate students from the University of KwaZulu-Natal College of Health Sciences. And who is that? It's only our very Miss Busi Siotula, our very own. Miss Busi Siotula, I just want to formally welcome you on our today's webinar. You are welcomed, and just take the podium. Thank you.
Okay, thank you, Dr. Tele, for that introduction. I would like to share my screen. Okay, otherwise I'll just speak from the heart if I'm not able to do that. As Dr. Tele has pointed out, October is the Mental Health Month. On the 10th of October, we celebrated the World Mental Health Day. And this year's theme is making everybody's mental health a priority on the global scale. Today, I'm just going to briefly talk about the anxiety. I tried to separate the fear from the anxiety by giving the comparisons. When you have fear, it can be from the real or perceived imminent threat, or a transient surges of autonomic arousal of fight or flight. We know that when you are experiencing some kind of a threat, it's either you fight or you flight, whereby your adrenaline levels get really high. So thoughts of immediate danger and escape behaviors become apparent in the fear. But when we look at the anxiety, the anticipation of future threat, intense, persistent, and it takes about 6 months. When you have been experiencing such intense fear for about 6 months or more, although it is shorter in children, we consider that anxiety. Previously, we used to say anxiety is the fear of the unknown, which means that it is a real fear, but you cannot pin it on one thing, that I am scared of this. It is associated with muscle tension and vigilance. It is cautious, avoidant behaviors that become prevalent. So when someone experiences fear, it only becomes an anxiety when it affects the functioning in general, which then becomes a diagnosable mental disorder. These disorders, the anxiety disorders, develop in childhood and persist if untreated. Mostly occur in females at a ratio of 2:1. It is diagnosable if the symptoms are not attributable to any physiological effects of a substance or medication or another medical condition, or are not better explained by any other mental disorder. So now we look at the generalized anxiety disorder, because that one is an umbrella. It's not just focusing on one type of anxiety like the phobias. So the generalized anxiety disorder, its essential feature is excessive anxiety and worry about a number of events or activities. The intensity, duration, or frequency of anxiety and worry is out of proportion to the actual likelihood or the impact of that which someone is concerned about. Then we look at the diagnostic criteria, particularly from the DSM-5. We have about a number of criteria that needs to be met for us to diagnose anxiety, like excessive anxiety and worry, apprehensive expectation, which is occurring more days than not for at least 6 months, about a number of events or activities such as work or school performance. The individual finds it difficult to control the worry. The anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. So that will be the time frame that will enable us to diagnose the generalized anxiety disorder. As I pointed out, in children, it may be of shorter duration than 6 months, and only one item is required for us to diagnose the generalized anxiety. And here are some of the things that you could identify the anxiety about: the restlessness or feeling kicked up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance, difficulty falling or staying asleep, or restlessness, unsatisfying sleep. Then the criterion D, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So you see it cuts across the board, which is why we term it the generalized anxiety disorder. For criterion E, we have the disturbance is not attributable to the physiological effects of a substance, for instance, a drug of abuse, medication, or another medical condition, for instance, a hyperthyroidism. Then we have criterion F. The disturbance is not better explained by another mental disorder. For example, anxiety or worry about having panic attacks in panic disorder, negative evaluation in social anxiety disorder, which will be the social phobia, contamination or other obsession in obsessive compulsive disorder, separation from attachment figures in separation anxiety disorder, which is prevalent in children, reminders of traumatic events in post-traumatic stress disorder, gaining weight in anorexia nervosa, physical complaints in somatic symptom disorder, perceived appearance flaws in body dysmorphic disorders, having a serious illness in illness anxiety disorder, or the content of the delusional beliefs in schizophrenia or delusional disorder. Basically, what criterion F specifies is that it is not better explained by any of the conditions that I named here. I just gave examples. Then in adults, the generalized anxiety disorder will often present as worry about everyday routine life circumstances, for example, possible job responsibilities, health and finances, the health of family members, misfortune to the children, or minor matters like household chores. And children with generalized anxiety disorder tend to worry excessively about their competence or the quality of their performance, whether at school or at home or in sports. During the course of the illness, the focus of worry may shift from one concern to the other, hence it's called generalized. Worries are excessive and interfere significantly with psychosocial functioning. Worries are pervasive, pronounced and distressing, of longer duration, and mostly occur without precipitance. So it can just be spontaneous without any identifiable trigger. The greater the range of worries, the severe are the symptoms. That is important to note. If there are many worries that one is concerned about, then the symptoms tend to be severe. Then we look at the physiological symptoms of how the generalized anxiety disorder is likely to present. One might have cold or sweaty, clammy hands, a dry mouth, heart palpitations, nausea, numbness, tingling sensation in hands and feet, muscle tension, shortness of breath, such that people may even say there is a feeling of impending doom. Some of the mental symptoms are feeling the panic, fear, uneasiness, experiencing nightmares, repeated thoughts or flashbacks of traumatic experiences, uncontrollable obsessive thoughts. Then we look at the physical symptoms now together with the behavioral symptoms. So I've just mentioned the mental symptoms. Now we look at the behavioral symptoms. That will be restlessness, the ritualistic behaviors, particularly if there is an obsessive compulsive component, then trouble sleeping. So that will include the physical, the mental, and the behavioral symptoms. So the individual suffering from generalized anxiety disorder might experience from all these points that I've mentioned. Then the causes of anxiety. It is a combination of factors which include the chemical imbalance, environmental factors that may trigger a generalized anxiety disorder where there is susceptibility. For instance, trauma due to illness, cumulative stress, personality constellation. Some people tend to worry easily by virtue of their personality constellation. If there is other mental disorders, it could be hereditary if there is a family member of biological descent that has a generalized anxiety disorder, reduced frustration tolerance from drugs, alcohol, or other substances that will decrease the tolerance. Just to capture on the definition of mental health by the World Health Organization, the World Health Organization defines mental health as a state of well-being in which the individual realizes own abilities, can cope with normal stresses of life, can work productively and fruitfully and is able to make a contribution to their community. So from this definition, you can automatically tell that a generalized anxiety disorder is impacting this ability to cope with normal stresses of life, because it is of a severe proportion and it impacts on the general functioning. So now I'm trying for us to look at how anxiety has come about in the midst of the COVID-19. We know that as human beings, particularly in the African culture, we are social, filial, and communal beings. So at the end of 2019, mostly 2020 and 2021, the whole world was engulfed by the wave of death, fear, and uncertainty when we experienced the pandemic. We experienced the total shutdown of many countries as we went through the devastating waves of the worst death tolls in our lifetime. Never before have we seen graves being dug in numbers as we witnessed during the pandemic. It was like a horrible nightmare that we have not managed to wake up from as we continue to experience the effects of the COVID-19. Watching TV, which usually is supposed to be the time for us to unwind, became the torture, because you would see the number of infections increasing daily, recorded on thousands of deaths, which was the scariest period of our lives. Initially, it seemed like propaganda, if you remember correctly, when we saw numbers before it hit us as South Africa, we even thought, is this even real? Until the numbers began to have the faces of the people we know. Then it hit home that indeed, this is not a game. It is not made up. It is a reality that we face as human beings now. So the pandemic toppled all our human or African practices. We tend to congregate as Africans where there's been a death to comfort one another. We would like to care for our sick, but during the COVID-19, that was not the case. If you send your relative or your loved one to the hospital, often if it was severe enough for them to be hospitalized, it was like a goodbye, because you couldn't even go and visit them. And that evoked a lot of uncertainty and fear, bordering on the anxiety levels. Even in churches, the churches were closed where people would go to distress. So people couldn't go there. And we even heard that this isolation, which was imposed because it was a measure of trying to control COVID-19, we had increasing levels of gender-based violence. We experienced unemployment as there was a lot of job losses. We became the world at war with an unseen enemy that pounced on us when we least expected it, which was the giant thief that came to rob and destroy, and it had the face of COVID-19. So this is just to paint the picture of how COVID-19 impacted us. As a result of the emergence of COVID-19, it was caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2 infection in the Chinese city of Wuhan. That's where it started. A situation of socioeconomic crisis and profound psychological distress rapidly occurred worldwide. Various psychological problems and important consequences in terms of mental health, including stress, anxiety, depression, frustration, and uncertainty during the COVID-19 outbreak emerged progressively. The COVID-19 infection has a direct impact on mental health of both the infected, those are the sick ones, and those who are affected, that is the families and the general population. So the quarantine related to COVID-19 infection also affects the psychological well-being, resulting in psychological reactions in the general population as a result of COVID-19 outbreak. So the importance of being mindful of the role of risk and protective factors against the potential to develop psychiatric disorders in vulnerable individuals became heightened. Science pinpointed traditional practices of support that I have mentioned above as super spreaders of the pandemic, which left us as human beings now defenseless in the face of this unseen enemy. Nursing loved ones when they are ill was prohibited because of the fear of contracting the COVID-19. Even helping someone who is experiencing some kind of difficulty became a taboo, such that our humanity, ubuntu be to try and reach out and help, was that got hampered because of the fear of contracting COVID-19. Testing positive for COVID-19 became the most lonely and scariest journey for patients and their loved ones, particularly because the support system that we are used to got removed by the COVID-19. The homes became the places of deep-seated pain, tears, and hopelessness. So COVID-19 completely changed life as we know it. Similarly, lamenting the pain and the uncertainty of what the future holds for us and future generations became palpable. Humanity lamented the core violation of the sense of security. Some of the other effects of the pandemic, the COVID-19, the increase in the rate of GBV, as I have mentioned, poor frustration tolerance from various sources with no outlets during the lockdown. This heightened cracks in the family unit. Of course, for other families, this period of togetherness created opportunities to bond and know one another better as we took time off work and stayed together as families. Education from early childhood right up to tertiary suffered and has not fully recovered. We see the gaps. It hampered spiritual growth and support, particularly during the times of vulnerability, like losing a loved one, make us susceptible to a myriad of social ills. Increase in mental health concerns, for instance, anxiety, loss of control, worrying about safety and the future became heightened. Increased reliance on technology and increased data consumption impacting on connecting and staying connected, working and learning from home, holding virtual meetings. A number of us who were able to work from home began to work from home, but others, of course, who were termed the essential workers, then were not allowed to work from home, which again worsened their anxiety because each day they leave to go to work, they would not know whether they will come back not being infected, particularly if they are working in conditions where people were admitted with florid COVID-19 symptoms. And the prognosis was quite uncertain. So there were looming severe shortages of resources. We remember the times when we were concerned about the resources of ventilation and even managing it, even as the hospitals. Even for testing and treatment, there were challenges as not everyone could test because it became costly. Impositions of unfamiliar public health measures that infringe on personal freedoms. You were not allowed to roam around the streets or to be seen just walking freely because of the COVID-19. Large and growing financial losses, conflicting messages from authorities and social media, which was scary. All these are among major stressors that contribute to widespread emotional distress and increased risk for psychiatric illness associated with the COVID-19. Also, there was economic instability, which was caused by the economic inactivity during the lockdowns. 7 out of 10 respondents in the SA COVID-19 Rapid Gender Assessment Survey reported that they experienced economic difficulties and resultant job losses between 26 and 32%, which worsened our plight, particularly here in South Africa and many other African countries. During the pandemic, compared to prior to the pandemic, contributing to an already high unemployment rate. So there was pervasive helplessness, which means that the generalized anxiety disorder became quite prevalent. Now, that meant we have to find a way of coping with this kind of trauma and this kind of heightened level of anxiety. One of the issues of helping us to cope better with anxiety is first to be aware that we are indeed feeling out of our depth and we are feeling overwhelmed by what is happening around us. So it helps to be aware and familiar with the physiological changes that I mentioned earlier, the physiological and the psychological symptoms that I listed when I started off, so that you can know that I am unable to function at the level that I'm used to functioning at. Because what this meant is our usual coping strategies become overwhelmed and we needed something else to be able to cope and survive. What became even more prevalent is the deaths that were happening in families in numbers. Usually when someone is ill, it would just be that person who dies. But when COVID hit us, you would find that families lost more than 1 or 2 members. In some families, children were left without parents in a very short space of time, which meant now that the children have to fend for themselves to find a way of coping, and the communities have to find a way of supporting those children. But what's even worse is that no one was immune. You did not know how best to survive the COVID-19, which heightened the level of anxiety and of course impacted on our mental health well-being. So the importance of knowing these physical and physiological or mental health symptoms that one presents with when they have COVID-19, when you have the generalized anxiety disorder, it helps so that you can keep track of what's going on in your own health, but also it provides an opportunity to find ways, adaptive ways of coping with the generalized anxiety. For instance, if we had a thermometer, unfortunately I couldn't load it up here, you will be able to see that at the bottom of the thermometer, you will still feel calm. Yes, there is some level of discomfort, but at least you are still feeling calm and you are feeling fine. But as you become more and more
can I disturb you, Ms. Siatola?
Hello?
Okay, would you be able to email me your presentation so I can share it for you?
Yes, I will do that when I'm done.
Oh, okay, cool.
Yeah, okay, thanks. Okay, so as the anxiety grows, you become a little uneasy, you become noticeably worried, you have these flashing thoughts of worry, you are feeling unfocused and you are stressed, you have trouble thinking clearly, feeling physically uncomfortable because there are physiological symptoms that you experience as well, repeatedly thinking about the problem. Now you are getting to the mid-level of the thermometer in between the 6s and 7s. By level 8, you are now feeling overwhelmed. Level 9, you feel very anxious, difficult to function. And at level 10, which is the peak of the thermometer, you feel extremely anxious and unable to function. So all these symptoms make it difficult for someone to say, I am mentally healthy, according to the World Health Organization definition of mental health. So in order for us to be able to control this overwhelming sensation of not being able to cope and not knowing how to survive, and the feeling of impending doom, it could be managed by using what we call the deep breathing exercises. Usually what happens is one needs to be in a comfortable position and take deep breaths, counting slowly, say for a few seconds, holding the breath and then taking it out, because that helps to reduce the physiological symptoms. And practicing this technique helps to reduce the anxiety and the physiological as well as the psychological impact of being overwhelmed. But should that not help, going for psychotherapy is one way of getting the support to deal with the generalized anxiety disorder. But also, if that is not enough, there is medication, which we call the anxiolytics, that will target the chemical imbalance that I spoke about earlier. So these are the mechanisms that will help people to cope with the generalized anxiety disorder, because it can be debilitating and it prevents someone from functioning at the best of their ability. So it is important then to monitor how you are feeling and how you are coping, and looking at globally in your different spheres of functioning. How is this impacting me, and how is it affecting my functioning and productivity? I'm not sure whether there are any questions, but I will then email my presentation to Dr. Tsele for sharing. But generally, we find that at the clinics, help is accessible. If you go to the clinic, they will refer you to the mental health practitioner, or you may be seen by the nurses and the doctors at the clinic, because they also are aware of what mental health is. And it's not easy for you to be missed and not know what to do when you can get help at the clinics. Another challenge is for the parents to be aware of how it impacts children. I know that previously we used to say children are seen but not heard. I think we all need to change that and begin to hear the children as well, and observe that they are not doing okay, so that they can also access help. Because without help, generalized anxiety disorder can really be debilitating, and it impacts functioning globally and makes someone feel really overwhelmed and unable to cope. So in a nutshell, that's what the generalized anxiety disorder will look like, and how in the midst of COVID-19, we would be impacted as the community and as the society. That is all from me. I hope that will address the need for us to know what to expect when we are feeling anxious and we feel it is out of control, and finding the places to go should we need to manage, should we need support and means to access help. Thank you.
Thank you, Ms. Sotula. Thank you so much. Just 1 second.
Okay, I'll send you the presentation then.
Thank you so much, Busi, for a very brief and nice presentation.
Yes.
We really appreciate all the info that you have shared with us, hoping that people, they do have questions. At this present moment, let me allow questions from the audience. If there are, you can just raise hands. I'm waiting for hands, our audience.
Zama's hand is up. You can go ahead, Zama.
Thank you, Dr. Zama. You can just go ahead. Thank you. Nombuso, can you please switch on my video? Thank you. Thank you, Dr. Zama. Over to you. Dr. Zama, we are waiting for your question.
Hello, can you hear me now?
Yes, we can hear you now. We couldn't hear you.
Okay, I was struggling to unmute. It wouldn't allow me. All right, thank you to Mrs. Siotula. It's Dr. Kulu Kasaba. My question is, with all this on anxiety, are there any guidelines or maybe ways in which one could, for example, and see if they are perhaps suffering from any kind of anxiety that is related to COVID-19? Because sometimes our children don't speak out, but what kind of advice would you give us as parents for things that we might observe that might be, I don't know, cues or signs of some sort of anxiety related to signs of anxiety in line with COVID-19 or anything else surrounding it? That is my question.
Okay.
Signs that we can look out for.
Okay. Thank you, Dr.
Okay, before Siotula, you respond to Dr. Kesaba's questions. Let me take other questions if they are, so that you just combine them.
Okay.
Are there any other questions from the audience? Nombuso, can you please look for hands for me? If they are, then if there are none, then I will allow Siotula to respond to Dr. Zama's question.
No, she can go ahead. No hand yet.
Okay, thank you very much, Nombuso. Siotula, you can just go ahead and respond to Dr. Zama's question. Thank you.
Okay, thank you. It will either be the physical symptoms that the child or whoever is experiencing the generalized anxiety disorder would present with. For instance, I alluded to the cold, sweaty hands, the dry mouth, the heart palpitations, nausea, numbness, muscle tension, the shortness of breath. Usually that's how they would present, particularly at the clinics. Or it could be mental health, it would be mental symptoms as well, like that feeling of panic, like their heart is going to stop anytime. They would kind of present and say that I feel like I have a heart problem, but when they are checked, you find that there is nothing physiologically wrong with the heart. But perhaps I should just specify that although I tried to contextualize it in the space of the COVID-19, it is not very separate from the generalized anxiety anyhow. It's just that the COVID-19 came with so much for the people to cope with. So they will have the nightmares as well. They would present with repeated thoughts or flashbacks from the trauma of losing someone they love, or the uncontrollable excessive thoughts. Sometimes you will even see them now becoming over clean with their hands, such that they wash their hands so frequently, then you can begin to see that, okay, something is not right. Basically, there will be a noticeable change that you will observe. Even their behaviors, they may become more restless, and they may engage in ritualistic behaviors. They might have trouble sleeping as well. So those are the signs and symptoms that could help you to see that there is a change, and it helps them to begin to engage the child particularly. Or their fear may just be, I'm not going to be able to perform, particularly at school, given the fact that when the COVID-19 hit us, the children had to now learn virtually without any contact, without the adequate support that they used to have from their teachers and from their fellow classmates. So the fear of failing as well could enhance the symptoms, as I have mentioned some of them. I hope that answers you, Dr. Kulu Kasaba.
Dr. Kulu, thank you, Siyotula. Dr. Kulu, are you covered?
Yes, thank you very much.
Thank you so much. I just want also to emphasize, Siyotula, you'll agree with me, as we have said, there is quite a lot of people who have been previously affected by COVID-19, where we have observed and seen, especially being affected by obsessive compulsive disorder, especially when it comes to cleanliness. You know, they ensure that the way they are too clean, it's becoming too much, because they are having that fear. It means at their subconscious mind, this thing is still sitting so on their storage, that they don't want anything that it's not clean, of which sometimes it's even disturbed the way they work and their focus on whatever they do, to such an extent that they are actually overdoing this. So I just want to, I was just attesting to what you were saying, Siyotula. Thank you so much, Dr. Kesaba. Any other questions? Nomuso, do you have any other hands?
No, we're good now.
Okay. If there are no other hands, let me take this opportunity and thank all our participants or audience for participating in this webinar. Good people, I just want to emphasize it is important that we attend these webinars, especially that it's a mental health month. Like we always say, no health without mental health. It all starts with the mind, then before it can even affect your physical body. So it is imperative that we are here, and then let us all go out and spread the gospel in our families, communities, and societies, and even in our churches. Let us talk about this. Let us have platforms so that we prevent some of the unnecessary conditions of mental health that can develop, or that we can see even in our working environment. Also, Nombuso, as the coordinator and organizer of this, I just want to thank you so much. Keep on flagging our university flag high. And also, Kat, thank you so much for being here also as the panelist. To all the participants, Yotula, thank you so much once again. Please share, don't forget to share your slides so that we can actually share with the group. And then we are hoping that we had also a very good attendance on YouTube. Thank you so much to all of you. And then